Hello everyone, this is a very brief video on winging of the scapula. So first of all, we must know that winging is not specific to a single nerve. Yeah, so there can be a couple of nerves which can influence, which can cause winging of the scapula. So let's start with our first nerve. Our first nerve will be your dorsal scapular nerve. Yeah, DSN. Yeah. So here I've drawn vertebras. Yeah, doesn't seems like vertebras, but yeah, all right. So here are the vertebras. Yeah, and here is your this thing, your scapula. Yeah, and scapula, how can I know this is the dorsal aspect or posterior aspect of the scapula? Because it is I've drawn spine over here. Yeah, so here you can see a spine which is always present on the posterior dorsal aspect of the scapula. So it's easy to recognize that this is the, we are looking from the back of a patient, back of a person. Yeah, so here it is, here is the spine. Here are few muscles which I have drawn. Yeah, it is very easy to remember. So here is your right hand. Here, of course, it will be your right hand, because if the you're facing, you're looking at a person from the back. So this is your right humerus of a person. Now here are two muscles. Yeah, now two muscles are this one is teres minor and this one is teres major. Yeah, so it's easy to remember. So you can see teres minor and major, they are inserted on the humerus also, and they are going towards your medial part of the scapula. Yeah, so like this, this one is minor, this one is major. So teres minor, teres major. Yeah, so we must know about these two muscles, but this is just for the diagram purposes. But main muscles which will DSN is innervating are, one is your levator scapulae. Yeah, so levator scapula is coming from your back of your head and towards your upper part of the scapula, and plus your cervical vertebrae. Yeah, so this is your levator scapula. So even the name suggests levator scapula. It levates, it lifts the scapula. Yeah, so this is a levator scapulae, and these are then two major muscles over here. One is your, these are rhomboid shaped. So this is rhomboid again, just like teres minor and major. This one is also rhomboid minor and rhomboid major. So this nerve DSN, yeah, this dorsal scapular nerve. Yeah, even the name suggests dorsal, going to the dorsal part of the scapula, on your back side or on our posterior side. And the scapula, dorsal scapular nerve. Yeah, so it innervates all these three muscles. Yeah, all these three muscles. And of course you can see if these, any of these muscles are injured or if they are not functioning properly, then you will have winging of the scapula. All right, then we are done with DSN. Yeah, so one nerve very important to remember is DSN. Then another important major nerve which causes your winging is your over here, this is your accessory nerve. So accessory nerve is going, and it innervates your trapezius muscles. So here it is, again we are looking at the dorsal aspect of the scap of the patient. So here is your trapezius muscle. So it is innervated by accessory nerve. Yeah, so accessory nerve is innervating the this thing, muscle, trapezius. Yeah, so again, if accessory nerve or this muscle is not functioning properly, then again it will cause your winging of the scapula. Now the most important of these three is your this thing, this nerve, and this is your long thoracic nerve. Yeah, LTN, long thoracic nerve, goes and innervates your serratus anterior muscles. Yeah, serratus anterior muscles over here. So here is your sternum, and serratus anterior is a very beautiful muscles. As you can see, it's on your lateral side of your body. And so lateral, this long thoracic nerve comes and innervates your serratus anterior muscles. Yeah, so of course these can, and these can also cause winging. So out of these three nerves which I have discussed, one is your DSN, one is your this thing, accessory nerve, and one is LTN. Yeah, so three nerve are to remember here are DSN, LTN, and accessory. Out of these, LTN is very important because it causes the major part of your winging. If it is if this muscle or this nerve aren't functioning properly. So these are which causes your so here again serratus anterior muscles. So again it is the backside dorsal aspect of your scapula, and this is going into the, but they are into the it's front of the scapula over there. They are inside the, not on the backside of your scapula serratus anterior, but they are going towards your costal margins and towards your ribs. Yeah. So easy remember very easy to remember. LTN is wing lieutenant safeguards. Yeah, all just only remember wing lieutenant safeguards. So wing is for your W. W would be winging. Yeah, W would be winging. Winging is caused by L from L and TT from your left on your long thoracic nerve, and your S would be by of serratus anterior safeguards. Yeah, so SA safeguards. So is kind of an easy mnemonic to remember for these three nerves. So that's all for winging of the scapula. Thanks.